We begin our show tonight with extreme pressure being applied to Democrats in Washington from the left. You have just heard the program-length special comment from Keith Olbermann on MSNBC's Countdown, intended, obviously, to dramatically increase political pressure for health care reform. He's specifically talking about a technique that would increase political pressure on 6 Senate Democrats who are key to allowing a vote on health reform. The proposal, as Keith said, is to hold massive free health clinics weekly in the capital cities of the states represented by these 6 key Democratic senators. Senators Blanche Lincoln and Mark Pryor of Arkansas, Senator Max Baucus of Montana, Senator Ben Nelson of Nebraska, Senator Mary Landrieu of Louisiana, and Senate Majority Leader Harry Reid of Nevada. As has occurred in other states, doctors and nurses would donate their time to provide free care to thousands of constituents of these senators, to regular Americans in these states who cannot afford health care as it is provided by the health care non-system that we've got now. A similar free clinic held in Houston last month by the National Association of Free Clinics drew 1,500 people looking for treatment. The strategy at work here is that if funds can be raised to hold clinics like these in Arkansas and Montana and Nebraska and Louisiana and Nevada, it will be a way of doing well by doing good. Americans who are unserved by the current system will get some health care. And this dramatic, heart-wrenching means of providing it to them could shame their senators into getting out of the way of reform. Now, to shame them into stopping what is presumed to be a Republican filibuster of any health reform bill. Now, if seeing thousands of their uninsured or underinsured constituents in need of care isn't enough to shame those Democratic senators into allowing a vote on health reform, there is another way to break a Republican filibuster. And here we have some news for you. We can report exclusively tonight that 2 major power brokers on the left have told MSNBC that they are encouraging a Senate strategy now in which the leadership would revoke chairmanships and other leadership positions from any Democrat who sides with a Republican filibuster to block a vote on health reform. Regardless of how individual senators would vote ultimately on the bill, committee chairman or subcommittee chairman who allowed Republicans to force a 60-vote requirement for passing health care, who filibustered, Democrats who voted with a Republican filibuster, under this type of strategy would be in danger of losing their chairmanships. That would be the Senate equivalent of busting a lieutenant colonel down to private. This is cracking heads time in the Democratic Party right now. This is arm-twisting, vote-counting, are you a real Democrat time for the proponents of health reform. If senators aren't themselves shamed or pressured by their constituents into getting out of the way of reform, if threats to revoke leadership positions aren't enough to convince senators to get out of the way of reform, there is yet still even another option. It's through a boring-sounding Senate rule called reconciliation, which essentially just blocks a filibuster for specific kinds of bills. Under reconciliation rules, Republicans couldn't force a 60-vote requirement. The bill would have to pass with just 51 votes or just 50 votes if Vice President Joe Biden was to provide the tiebreaker. If the reconciliation rules were used, there couldn't be a filibuster. There wouldn't have to be 60 votes. And health reform would have a very good chance of passing. Actually, it would have a better than very good chance of passing. And so opponents of health reform are now trying to make using reconciliation rules sound dastardly, unprecedented, crazy. Who would ever do such a thing? It's never been done before. Here, for example, is Republican Senator James Inhofe of Oklahoma speaking on conservative talk radio this week.
I think they're going to have a hard time doing reconciliation because that would be the first time on a major tax bill that that's been done in our nation's history. And I don't think that Harry Reid really wants to do that.
That would be the first time reconciliation's been done on a major tax bill? That would be the first time? Actually, you remember that $1.3 trillion tax cut, mostly for rich people? President Bush's first tax cut? That was passed through reconciliation. Also, the second Bush tax cut, another $350 billion. That was also passed through reconciliation. So when Senator Inhofe says no major tax bill has ever been passed through reconciliation, maybe he's talking about some other country. I don't know. But then there's Democratic conservative Senator Ben Nelson of Nebraska, who has said repeatedly that Democrats should not expect him to go along with some crazy plan to pass something under reconciliation. No, Ben Nelson says he would not vote for something under those crazy reconciliation rules. That would be way too radical. Well, Ben Nelson, of course, not only voted for the first Bush tax cut that was done under reconciliation, when they did it again for the second Bush tax cut, Ben Nelson not only voted for that bill under reconciliation, but he was a critical vote. He was vote number 50. Vote number 51 that passed that thing was then Vice President Dick Cheney. The main obstacle to passing health reform right now is not just Republicans. It is conservative Democrats in the United States Senate, like Ben Nelson, like Blanche Lincoln, like Mark Pryor, etc. And being a conservative Democrat standing in the way of health reform, it seems like it's starting to become a lonely, increasingly uncomfortable place to be standing. Joining us now is MSNBC analyst and senior Washington correspondent for Newsweek, Howard Fineman. Howard, thanks very much for joining us.
Hi, Rachel.
You wrote at MSNBC.com today that even as you've been critical of President Obama's health reform strategy in the past, you think that he's maybe onto something now, that maybe things are going his way. Why do you think things have changed?
Well, I think he's being patient, and all that patience may work because he's tried very hard to bring all these so-called stakeholders to the table, all those different industry groups, and they think they're rolling him. That's what they think is going on. A lot of liberals, a lot of progressives think that that's in fact the case. But the president could have a strategy here if he can hang on and get this thing further down the track in Congress. Then I think he may have a moment where it becomes politically dangerous for all those interest groups to get up and leave the table. He may actually be able to have some power over them as this gets down to the last moments. At least I think that's the White House strategy.
Howard, the new Congressional Budget Office analysis of the Baucus bill came out today. It says that it will save more money than had been expected before. One response that was highlighted on the New York Times website today was that hospital groups are upset because they say the new analysis shows that the bill doesn't get close enough to universal coverage. So it's not going to cost as much money as expected, and it's not covering enough people. I wondered if this could be an occasion for making the bill more progressive, spend a little more, cover a few more people.
I think it could be. I think it could be. And there's very little cost containment in the bill, either on the private side, which is, of course, the whole rationale for a public option. Remember that. So this bill is going to successfully, I think, put a floor under the negotiations, if you will, Rachel. And I think the dynamics in the negotiations, keeping in mind, though, the complexity of the Senate, they're all going to be in the direction of trying to improve the bill as far as the president is concerned, I think. That CBO thing was very significant because the Republicans had put a lot of stock in the CBO numbers. Now they can't walk away from the bill just based on that.
If it was an HBO analysis, it would have more swearing, presumably. Howard, what kind of pressure are conservative Democrats feeling right now? I mean, we're coming off of Keith's hour-long special comment. He's proposing massive free health clinics in the capital cities of states that are represented by the conservative Democrats. We're seeing all these other different types of pressure on the conservative Democrats. What do you think is most likely to have the best leverage against them?
Well, I think people who want true health care reform have to try everything from the outside, because the interest groups, the hospitals, big pharma, the insurance companies, you name it, they're controlling the inside game here, Rachel, and it's a very tricky thing that the White House is trying to do, to try to harness that energy somehow and play it back on them. That's the inside game, very high stakes. Meanwhile, if you're going to put any pressure on the conservative Democrats, you got to do it from the grassroots. I talked to a couple Senate offices about Keith's idea and about this thing in the state capitals. That's not on their radar screen yet. They hadn't even heard about it yet. But it should be the objective of the people out in those states to make those people fully aware of it, including Harry Reid, who's, of course, the critical player.
Howard, one last question for you. We have been tracking the politics and health reform every day for months now, and it strikes me that looking back at the things that we've covered recently, we're no longer really talking about Republicans at all in any mainstream sort of way. It's sort of like shots at Jim Inhofe when he said something like he said about reconciliation, but they're not the heart of the story anymore. Do you you think there's any real political oomph left from the Tea Party folks and the death panel people and the other real vocal anti-reform forces that we saw get some traction outside of Washington this summer?
I don't think so. I think the Republicans are hoping that those people will show up and vote Republican in the 2010 midterm elections. But in the meantime, it's clear that the president and the Democrats control the game. And by the way, you said Republicans are out of the picture. Republicans on the Hill are out of the picture, but Republicans in the rest of the country are getting in the picture. Now, they may have motives here. You know, Bob Dole may, he says he's for reform. What does that really mean? Arnold Schwarzenegger, Mike Bloomberg, you name it. They may like the bill that exists, which might not be real reform, but at least they're being drawn in. And I think the president is slowly but surely drawing people into the room, and he might be able to close the door without letting them get out. I think that's what he's going to be trying to do down the road.
MSNBC analyst and senior Washington correspondent for Newsweek, Howard Fineman. Howard, your reporting and insight invaluable as always. Thanks for joining us.
Thanks so much, Rachel. Thank you.